Welcome. This is one of a continuing effort by GA Investment Management to bring educational topics virtually through the airwaves to our clients and to others. And today we're going to be talking about Medicare. Medicare is very, do you still have that book with you, John? No, we don't have that book. But Medicare is a huge program, and every one of us will face it. In fact, John just helped me out. I am still working. So I needed to sign up for Medicare Part A. And it's like a cat in a hat book that I read a long time ago. There's little cats A, B, C, X, Y, Z. There's all different parts to Medicare. There's the book. You can see this book. So if you probably get that in the mail as you're turning 65, and boy, it's hard to read. So we're fortunate to have John Harford with us today. I've known John for 30 years. He's a second generation insurance professional. They've been independent agents. John's father before him. And John represents a number of different Medicare insurance companies. And so he can help with all kinds of Medicare related questions. So without further ado, John, why don't you tell us, what is Medicare?
What is Medicare? Well, first, before we get started, I would like to thank Steve and GA for inviting me here. I also want to thank Cassidy Schmidt for setting this up and being our technician. Where would we be without our technical advisors, usually our children? So I want to thank you for attending. I hope that this will be helpful for those that are becoming eligible for Medicare and those that are already on Medicare, or maybe have some family members that are becoming eligible or on Medicare. So I'm going to go through a lot of the rules of Medicare. I'm not going to get into any specific company or products. This is going to be an educational seminar. So we're going to start with, what's Medicare? Well, it's health insurance that for people that are 65 or older, or those under 65 with certain disabilities. And it is also for people that have end-stage renal disease, which is permanent kidney failure resulting in dialysis or kidney transplant. So let's talk about the different parts of Medicare. And we get into the letters. There's a lot of letters in Medicare. Part A is your hospital insurance. And once you turn 65, you're automatically enrolled in Part A. Most people do not pay a premium for Part A. However, some people do not qualify for premium-free Part A. But that pays for the hospital insurance, and anything a hospital will charge for. Part B, on the other hand, is your medical insurance that pays your medical providers. It also includes some other services, and I'll get into more detail on what Part A, Part B covers. Part C, on the other hand, is your Medicare Advantage plans. Those are plans that are offered by private insurance companies that include Part A and Part B coverages. It's kind of a comprehensive plan. You see them advertised all the time, especially during open enrollment periods. Those, most of the time, they do include prescription coverage. However, not all do. Part D refers to the prescription drug coverage, which is offered by private insurance companies, which are approved by Medicare. So we're going to get into a little more detail on what's covered under these different parts. Medicare Part A, your hospital insurance, includes inpatient care in hospitals, also includes skilled nursing care, hospice, and also some home health care. Part B, on the other hand, covers services from doctors, other healthcare providers, does include outpatient care that is done in a hospital, but on an outpatient basis. It includes coverage for medical equipment such as wheelchairs and canes and braces and those kinds of things. Does include some home health care as well as wellness and preventative services. So that's your Part B. Part C, I mentioned, was your Medicare Advantage plans. Those are offered by private insurance companies. They all have to include the same coverages that Part A and Part B have, and they usually do include prescription coverage. However, they don't have to. The one thing about Part C Advantage plans, most of them have extra benefits built in there, such as dental, vision, coverage for hearing aids, silver sneakers, gym memberships, that kind of thing. And I'll get into the specific ancillary coverages that are covered. Part D is your prescription coverage, and that covers the cost of outpatient prescription drugs. It is run by private insurance companies. They have to be approved by Medicare to sell those. Now let's talk about the two main ways to get your Medicare coverage. The first one is to purchase, well, you'd be eligible for your Part A, and then you sign up for Part B. You would need to, and you don't have to buy a prescription plan. That would be separate. But it is a good idea to sign up for it, because if you don't, there are penalties if you sign up later. You can also buy, in addition to those, what's called a Medigap or a Medicare supplement plan. And those pay your out-of-pocket expenses with Original Medicare. And we'll get into a little more detail on what are your out-of-pocket costs in Original Medicare, and they can be considerable. And the other way is to purchase a Medicare Advantage plan, which has Part A, Part B coverage. These are plans that, like HMOs, PPOs, that are offered by private insurance companies. So let's get into a little more detail on these options. Option one is where you keep Original Medicare. Includes Part A, your hospital, and Part B, your medical insurance. There is a premium that is charged for the Part B. The standard premium for this year, for 2020, is $144.60. Now, it can be higher depending on your income, and I will show you a chart for those in the upper income levels, the amounts that is charged for that. You can also add prescription coverage to your Part A and Part B, and you can also add a Medigap or supplemental Medicare insurance plan to your Part A and Part B. The option two is to replace Original Medicare with an Advantage plan. And these are HMOs and PPOs that cover your Part A and Part B, and most of the time your prescription coverage. The extra benefits that I talked about, most of them have coverage for dental and vision. There's coverage for hearing aids. A lot of them offer transportation services to and from doctors' offices or to the hospital. They also include your silver sneakers, gym memberships, And a lot of them now are adding coverage for over-the-counter medications. Your Part A costs, if you just have Part A and don't have a supplemental plan, I said they couldn't be considerable. And most people don't pay a premium because they've been paying into the system all their working lives, or their spouse has been working. So they qualify for premium-free Part A. But some people don't qualify for premium-free. If you haven't been working, and you could pay up to $450 each month for that coverage. But most people will get it premium-free. They also include co-pays and deductibles. There is a $1,408 deductible for this year, and these are usually tweaked a little bit each year, but there's a $1,408 deductible per benefit period. There are also co-pays for inpatient stays. After your 60th day, the copay is $352 per day from the 61st to the 90th day for each benefit period. Now, let me explain what a benefit period is. Because the deductible is not an annual deductible, it's a benefit period really is, it starts from the first day you're admitted to the hospital, and it ends when you're discharged from the hospital. And if you're discharged and you do not re-enter the hospital for at least 60 days, then if you were to go back into the hospital, that would be the beginning of a new benefit period. So therefore, you could pay a deductible more than once per year. If you're admitted within that 60-day period, then it would be considered the same benefit period. They're not going to hit you for that deductible again. And so now after the 90th day, if you're still in the hospital, you're into your lifetime reserve days, which they give you up to a maximum of 60 of those, but there's a copay of $704 per day for those, and you only get 60 of those for your lifetime. So those are your costs, and this is one of the reasons why people buy supplemental plans or purchase advantage plans, to limit their cost, because it can be considerable.
You weren't kidding when you said it could be considerable.
It can be a lot of money out of your pocket.
Another thing is, for all of us that have been covered while we were working, we're used to this period being typically annually,
Right.
or in a policy year, a whole
Right.
year.
Yeah, this is a new thing.
So it's just how long we stay in the hospital. You could have, I don't know, what's that, 3-4 a year.
Yeah, you could pay 3 of those deductibles per year, conceivably. Unlikely, but it could happen. Okay. There's also skilled nursing coverage within Part A. There are co-pays for services that go beyond 20 days. It's a $176 copay starting on the 21st day up to day 100. There is no coverage beyond 100 days, and that's why a lot of people purchase long-term care policies to cover those skilled nursing facilities beyond the 100th day, and they can be very considerable.
John, Medicare, will it pay any if you have nurses come to your home, in-home nursing, like your long-term care policy?
Yes.
Do?
That would be home health care.
Okay, so they do have a home.
Yes, there is coverage for that. Part B costs. Well, I talked about the premium, the standard premium being $144.60 that is being charged for this year. Again, this is something that is tweaked every year. It doesn't necessarily have to go up. but it usually does go up a little bit. It does depend on your income, and I'm going to show you a slide next that will show you for the upper income levels the additional premium that will be charged by Medicare. There is also an annual deductible with Part B, and for this year it's $198. So you would only pay that one time, and it would reset every January. Now, one of the big reasons a lot of people buy these additional coverages is the co-insurance with Part B is 20%. So they paid 80%, you pay 20%, and there is no maximum on that. So you're going to pay 20% forever. So that can be very considerable. If it's a surgery, a major surgery, that can be a considerable expense on your part. So this is the chart that shows you if you're married filing jointly making more than $174,000, you are going to pay an additional premium on top of the $144.60. Your premium would go up to $202.40 if you're in that $174,001 to $218,000. There's also an additional premium that they tack on to your Part D, your prescription coverage. And these additional costs are billed to you from Medicare. So for instance, if you purchase a prescription plan from a private insurance company, the insurance company isn't going to bill you this. It's going to actually be tacked on to your Part B premium, and it's billed by Medicare. And there's a number of ways that you can pay that, which we'll get into.
John, those income-related bands, that's modified adjusted gross income.
That's right. Yeah. That's right. And they go back 2 years. They're looking at your modified adjusted gross income that you put on your tax form 2 years ago. So Social Security is going to look at your taxes, and they're going to determine if you are going to be charged this, it's called income-related monthly adjustment amount. And it will be tacked on to your Part B premium. It will, most people have it automatically deducted from their Social Security if they're collecting Social Security. However, you can't pay for it through your bank. You can sign up for Medicare Easy Pay, have it deducted from your checking account, or you could just receive a paper bill every month and pay it that way. So these are determined by Medicare. You can pay it the same way you pay your Part B premium. You don't pay it to your prescription drug plan. You're going to just pay it directly to Medicare. You do have to keep in mind, though, this works just like any other premium bill. If you don't pay the extra premium, you could lose your coverage. So it's important that you do keep up to date on that. Okay, let's talk about initial enrollment period. There's a number of enrollment periods. One of the big ones is the initial enrollment period, and that's where you're first eligible to sign up for Medicare. And typically it's a 7-month period that begins 3 months prior to your 65th birthday, the month that you turn 65. It includes that month, and then 3 months after that. When you become eligible, no matter what day your birthday falls on the month, the coverage always begins the first of the month. I personally am turning 65 in July next month, so I'm going to be covered. Even though my birthday is on the 30th, my coverage is going to start July 1. So that is the time when you can sign up for either a Medigap supplemental plan or an Advantage plan. And now the Medigap supplemental, if you decide to go that route, the initial enrollment period's a little different. It runs for 6 months, starting the month you turn 65. And you do have to enroll in Part B to purchase either an Advantage plan or a supplemental plan. Now, you don't have to buy Part B. Some people want to go without that. But there is penalties if you want to sign up later for Part B. So it's usually a good idea to sign up for Part B. Now, if you are continuing to work and you're eligible for a group plan, like Steve here, usually it's a good idea to keep the group plan through your employer, delay in getting the Part B, and you would be eligible to purchase that later without any penalties, because you're just delaying it until you retire. So then your initial enrollment period would begin then. So you're not susceptible to any penalties later on. There is no medical underwriting for the Medigap supplemental insurance if you sign up during your initial enrollment period. So if that's the route you want to go, it certainly makes sense to purchase that when you're first eligible. Because of that, there's no medical underwriting, there's no pre-existing condition clauses. If you choose to enroll or try to enroll in a supplemental plan after that 6-month period, they can ask health questions and they can turn you down. And chances are, if you have any serious issues, you're not going to be able to get it. So it's a good idea, if this is the way you're going to go, then to get it during your initial enrollment period. Okay, there's also your open enrollment period, which now for this year, the open enrollment period is over because it was actually ran from October 15th to December 7th of 2019. If you were going to sign up for this year, it will open up again for next year come October 15th, running to December 7th. And at that point, you can purchase an Advantage plan, and you can switch plans. You can switch from one company to another company. You can upgrade your coverage. You can downgrade your coverage. But that during that open enrollment period, you can actually apply for different plans. The last plan you apply for is the one that's going to take effect on January 1st. So that will open up October 15th. That's if you're in an Advantage plan, it's a good idea to review the coverage you have, because premiums change, coverages change with each of these companies. So it's a good idea to review these coverages during the open enrollment period and to see if it really is the plan that fits your needs. Now, the open enrollment period, the Medicare Advantage open enrollment period is January 1st through March 31st. This is a time when you can also switch from one plan to another plan, but you only get one time to do it. You get one switch if you want to. There is also what they call the Part A, Part B general enrollment, which runs the same time as the Medicare Advantage open enrollment period, which is January 1st to March 31st. And this is a period where people that did not sign up for Part A or Part B can do so. and they have to do it during this time period. That you could also go from, if you have an Advantage plan, you could switch back to original Medicare and perhaps apply for a Medicare supplement plan. But remember, if you're beyond your 6-month initial enrollment period with the supplemental coverage, they can ask health questions and you may not be able to get it.
Hey, John, I have a question here, and I forgot to, I was remiss, I didn't say at the beginning that please, if you have questions, you can type them in. Well, they didn't make this confusing, did they? See, so anyway.
Look at the book.
Right, exactly. So when you went back to the question is the Medicare Advantage plan. So that's like if I went with Highmark or UPMC or something initially. I turned 65 and I said, I want an Advantage, I don't want a supplement. I can only switch that once in my life.
The Advantage plan, no, you can switch it during these enrollment periods.
Okay, so it says that open enrollment, I think that one-time switch per year.
That's per year.
Once per year.
Right,
So I
once
could go
per
from
year.
every year I could change my Advantage.
That's correct.
How about your supplement?
Supplement plan, once you purchase it, it's guaranteed renewable. Okay,
But
they
if
can't
I have
cancel,
health-
but
If I get health problems, I can't change. I'm there.
no, you're probably going to be locked in with that
Yeah.
plan. But if you develop serious health problems, you're going to be happy that you purchased a supplemental plan
Oh,
because it does offer more comprehensive coverage. It is a little more expensive than an Advantage plan, but it offers much more comprehensive coverage. Okay.
These are very individual decisions.
Yes, that's correct. Now, I didn't talk about the 5-star Medicare Advantage enrollment period. I'm going to get into the 5-star ratings that they will give to Advantage plans. If there is a 5-star Advantage plan available in your area, you can actually sign up for that between December 8th and November 15th. So it's, that's goes beyond the open enrollment period. And as far as I know, there are no 5-star Medicare Advantage plans available in this area. It is kind of rare that a company will get a 5-star rating. And I'll talk a little bit more about these ratings and how you can use them to help evaluate your plan and when it's appropriate to use those. Okay. All right, a little more about the open enrollment period. It runs from October 15th to December 7th. The changes would take effect in January. So if you purchase a plan this year during this enrollment period, it'll take effect January 2021. You can switch from original Medicare, go to an Advantage plan. There are no health questions ever asked with an Advantage plans, but the only restriction is you can only purchase it at certain times of the year. You can also switch your Medicare Advantage plans back. You could go back to original Medicare. This is when you could purchase a Part D prescription plan during this time period. You can switch from one company to another. You could switch from Highmark to UPMC. You can switch your Part D plans, go from one insurance company to another. So that's during the open enrollment period. The Medicare Advantage open enrollment period, which begins January 1st, runs through the end of March. And whatever you sign up for, the plan would take effect the month after you submit your enrollment. And this is when you can switch from a Medicare Advantage, go back to original Medicare. You can purchase a Part D plan. And like I said, you can switch from one Advantage plan to another. You can only make one switch during this time period, as opposed to the open enrollment period where you can apply to several different carriers, and the last one you applied to, that's the one that's going to take effect. Then the Part A, Part B general enrollment period, that's for people that didn't sign up for Part B or Part A. You could have a case of somebody that doesn't, they're not eligible for premium-free Part A, and they decide not to purchase it. They could buy it during the Part A, Part B general enrollment period, and it would take effect then later in the year. It would take effect. So it actually starts 6 months. It would start in July. Okay, so, and this is to protect them from people that want to wait until they get sick and then they buy it. Okay, so that's the enrollment periods, and I know it's very confusing, and this is why it's a good idea to work with somebody to help you up through this. There are penalties that are applied for people that don't sign up when they're initially eligible for it. If you do not sign up for Part B when you are initially eligible, there is a penalty of actually 10% of the basic Part B premium, the $144.60, for each 12-month period that you didn't enroll. So if you didn't buy it and then 6 years later, or as the example shows, 7 years later, they're going to actually charge you 70% of the standard premium of $144.60. So that would actually make your premium $245.82 forever. Wow. You know, so that adds up.
That's a substantial.
Yes. Now, if you pay extra premium because you're in the upper incomes, they're not going to apply that 10% to the additional premium. Wow. It's just going to be on the standard premium. So how you would get charged these premiums from Medicare. They decide what the penalty would be based on how many years you didn't have the coverage, and that would be added to your actual premium amount. Okay, so, and we also talked about a penalty that is applied for people that don't sign up for Part D coverage, which is your prescription coverage. It's a good idea to purchase even a cheaper plan, just so you have credible coverage, so you're not going to pay these premiums, because once you get the penalty associated with your premium, you're going to pay that for life. And it can be substantial. With the Part D premium, if you did not purchase it, you would have a penalty of that would be added to your premium, and you must have credible coverage to not pay this premium. And how does that work? Well, they calculate it by charging 1% of what they call the national base beneficiary premium, which for this year is $32.74. So for every month that you don't have credible prescription coverage and you want to buy it later on, let's say you don't buy it until 2 years later, that's going to be a 24% penalty that they're going to put. They take 24% of the $32.74, and that's added to your premium, and it's charged for life. So it can be substantial. Now let's talk about a Medigap policy. What is a Medigap? Well, it's sold by private insurance companies. It helps supplement original Medicare. It pays some of the health costs that you are responsible for over and above what Medicare pays. And there are gaps. That's why I call it Medigap. They're all standardized. And again, we're getting into the letters. There's Plan A, B. Some are not sold anymore, but are grandfathered for people that have purchased it in the past. They're allowed to keep it. But these plans, if you purchase a Plan G from Highmark, it's going to be the exact same benefits that of Plan G from Aetna or any insurance company that is selling these plans. They're standardized. They have to be the same coverages. The only difference really is the premium that's being charged, and they vary. So now 1 year, one plan may be the cheapest. The next year it might be another company that's the cheapest. So it's just important to purchase it from a stable company, one you're comfortable with. But again, the coverages are the same, no matter what company you buy it from. Here is a chart showing you the different plans. Again, they're standardized, so if you buy a Plan A from one company, it's going to be the same as Plan A from another company. Some of these plans, like Plan F, is no longer being sold. That was the most comprehensive plan. It basically picked up everything, and they're no longer selling that. The richest plan now that you're going to find is your Plan G. It picks up everything except for the $198 deductible from Part B. So that is the most comprehensive plan. There are, I'm not going to go through every single plan, but this gives you an idea what the plans look like.
Hey, John, I have another question.
Okay.
Now, Medigap is the same as supplemental.
Yes.
And that's the one that if you have health conditions,
You may not get it later on.
The question is, may have medical conditions, can you switch from G to K or G to L? Or do you have to even stay within the same?
You'd have to apply again.
So you might not even be able to move in these columns.
Yes.
With medical conditions.
Yes.
Okay.
Chances are, if you have a Plan G, which is the most comprehensive, you could apply and they might give that to you.
They might give you a lesser plan.
Yes,
Yeah.
yes.
Okay.
But you'd have to stay within the same company.
Yes, correct.
Okay. All right. What do I need to know if I buy a Medigap? You can't really, you have to have Part A, and you have to pay the Part B premium. You have to have Part B to have a Medigap plan. You cannot have a Medigap supplemental plan and an Advantage plan at the same time. It's illegal for anyone to sell you an Advantage plan if you already have a Medigap, and vice versa. They don't go together. Also, a Medigap plan only covers one person. If you and your spouse want to go Medigap, then you would need to buy one. Your spouse would need to buy one. You don't have a policy that's combined. Now, a lot of times they will offer a discount if both of you buy the same policy. You might get a discount. When you have a Medigap and you purchase it, and we talked about this is important. When you buy it during the initial enrollment period, there are no health questions asked, and there are no pre-existing conditions. But after that 6-month period, there are questions asked, and you could be denied, and you're going to see that there's a pre-existing condition exclusion in there that wouldn't cover an existing condition that, or anything you were treated for within the last 12 months. And by treated, they mean consulted a physician or taking medication for it. So that's important. Although some Medigap policies in the past did include prescription coverage, they're not allowed to now. If they're any sold after 2000 or January 1st, 2006, they're not allowed to include prescription coverage. So most people purchase a separate prescription drug plan from an insurance company, and it's a good idea to do that, even if it's a cheaper plan, just so you have credible coverage. These Medigap plans are guaranteed renewable. They cannot cancel them on you because of your health, as long as you continue to pay the premiums. And the prices they charge, they can do it any one of three ways. Most you're going to see are or attained age rated, meaning that you'll pay a rate at age 65. Typically, it will stay the same for 3 or 4 years, and then it starts to go up. As you get older, the premium will go up a little bit each year. They can charge based on issue age, meaning if you purchase it at age 70, here's what the rate is and here's what it's going to stay. There's also community rated plans that are the same rate at every age. Most you're going to see are attained age rated. Medicare Part C Advantage plans. These replace Part A, replace Part B. It's written by a private insurance company, and most do include prescription. You have to pay the Part B premium to continue to pay that. The advantage with the Advantage plans is they do limit your out-of-pocket cost. You'll have a maximum out-of-pocket, but the co-pays and the co-insurance that they charge varies depending upon the plan. But the main thing is they do limit your maximum out-of-pocket costs. And they do have additional benefits in there that make them attractive. We talked about that, dental, vision, hearing. Those are nice ancillary benefits that you're going to get with an Advantage plan, which typically don't come with supplemental plans. You would have, with a supplemental plan, you'd need to purchase a separate dental plan or vision plan, something like that. Now, when you're comparing Advantage plans and prescription plans, it's important to, first of all, most of these Advantage plans are going to have networks that you want to stay in the network to limit your out-of-pocket costs. PPO plans do have out-of-network benefits, but you're going to pay more out of your pocket if you use it. So one of the most important things is to compare the network to see if it has the doctors you want to use and includes the facilities that you want access to. Of course, you're going to look at the benefit coverage. What are the maximum out-of-pockets? What are the co-pays? The premiums. Now, you'll find some Advantage plans, a lot of them are zero premium. People ask, how can they give it to you for no premium? Well, if you think about it, you've been paying into the Medicare system all your working life, and you're paying that to the government. So when you purchase an Advantage plan from a private insurance company, they're being subsidized by the government to provide these costs. So a lot of companies do offer zero premium plans, but then they have other plans that will cost more money, but lowers your out-of-pocket exposure. Most of them do include the prescription coverage. A lot of them have network pharmacies in network. You want to see what pharmacies you're using. When you're looking at comparing Part D prescription plans, you want to go in and put the prescriptions that you're taking now. Most have websites that you can go on, put your prescription in there. It'll show you what tier and what copays you're going to pay, or perhaps it's not covered at all. So these are the most important factors that you want to look at before you make a final decision.
John, another factor, I guess, is also, you mentioned, because you have a network with the PPO. So if you're a snowbird and you spend 3 months in Florida, that comes into play as well.
Yes, it does. Yeah. Some companies do have networks available in all the states. Mm-hmm. Some have networks available in just some of the states. Okay, so you want to look at the particular company you're purchasing from, what networks are available outside of Western PA. Okay, a lot of people spend 6 months in Florida. Mm-hmm. Now, some companies offer in-network coverage in Florida for their network. Some of these companies that are national companies, they can have networks in every state. Okay, so that's important. If you travel a lot, that's very important. Now, I talked about the star ratings, and this is helpful, but you're not going to choose a company just based on the star ratings. And I'll explain what criteria they're using for these. I talked about the 5-star open enrollment period. There are no 5-star rated companies in this area right now. It doesn't mean that may change. You're going to see most companies are going to range from the 3, 3.5, 4, sometimes 4.5 star ratings, which is your average to above average. You want to stay away from the 2-star ratings or worse. They typically are going to have a time period where they have to get up to at least the 3-star ratings. So after you do the initial, looking at the networks, the costs, the benefits provided, and if you're all even, then you can use the star ratings. If everything is even, they have all that you're looking for, and one's a 3-star, one's a 4-star, and you might want to go with the 4-star. And they get these ratings. They're basically looking at, for the Advantage plans, they're looking at 5 different categories. Staying healthy, the screenings and tests and vaccines they offer, how do they manage long-term conditions, how is their responsiveness, do they get many complaints, are there problems getting services, or how many are leaving the plan, and of course they're looking at customer service. They also rate prescription plans based on 4 different categories. They're looking at, of course, service, complaints, how many leave the plan, and of course, you have to look at pricing and patient safety. So this is kind of the last thing you want to look at. All insurance companies that offer Advantage plans have to provide their star ratings when they give you the material to enroll. So is disclosed, it has to be disclosed, and it is a helpful tool. So we've come to the end of our presentation, and I want to thank everybody. If you have questions, please submit them. If we don't get to them now, we could certainly email you. So I want to thank everybody for attending today. Thanks, Steve and GA, for inviting me. And I'd be happy to help anybody that is looking for assistance. This will be posted on the GA website
Yes, and Facebook, I
and
believe.
Facebook.
Whatever those kids
So,
do.
so if you want to refer to it later on, you'll be able to do so.
John, I want to thank you. I've sat in with our clients and you and a number of these presentations, and of course, my own personal situation, and I still don't have any idea what's going on there. So it's so complicated, and I get to summarize. I would say you need to work with John or someone like John that has multiple companies that can say, "Tell me about yourself. Are you going to be traveling? What prescriptions do you take? What doctors do you use? What's important to you?" Because it's a big decision.
Yes, it is. And everybody's situation is different. You know, somebody asked me, well, what's the best plan? Well, it depends on your situation, and we need to analyze your situation. Just like when Steve's looking at your financial institution, you know, what stocks are the best to buy? What are the best bonds to get? You got to look at their particular situation, and your situation may change. So, you know, this is something that needs to be looked at every year. You need to stay on top of it. And do I have the best plan for my current situation? So,
thank you very much. I don't see any other questions, but if any come in after the fact, we will make sure that we get them answered for you.
All right. Thank you for attending, and have a great evening. Thank you.
Thank you. We have to figure out how you turn it off.